A woman stands in a narrow cell with her arms strapped to the wall, undergoing treatment for mental illness in 19th century Germany, circa 1890. A young woman holds her arms and legs in 4 water baths with electric current to improve blood circulation, circa 1938. A chest X-ray in progress at Dr. Maxime Menard's radiology department at Cochin Hospital in Paris, circa 1914. Menard would later lose his finger to side effects from operating the X-ray machine. A lunatic's chair used for patients with poor behavior or wild outbursts in a Dutch mental hospital, 1938. A doctor wears protective clothing during an outbreak of plague in Manchuria, circa 1912. A machine with 4 flexible rods attached to the brain to transmit data, designed and used in 1940 to measure brainwaves. A man enjoys a sunray lamp, circa 1930. A man restrained in a straitjacket stands alone. A patient lying in an artificial respiration machine called an iron lung, circa 1938. A patient undergoing lateral cerebral diathermia treatment in the early 1920s. Diathermia used a galvanic current to jolt psychosis sufferers. It was eventually deemed unsafe and unreliable. A rotating cobalt machine swinging around the body of a patient to target cancerous tumors, 1955. A wire suit designed to measure body temperatures while researching the physiological effects of high-speed and space travel, 1960. A woman inside an electric bath at the Light Care Institute. 1900s. A woman wearing a flu mask during the flu epidemic that followed World War I, 1919. An elderly man sitting in a machine used to stimulate blood circulation in the legs, 1950s. Ergonic chair for administering General Electric treatment for psychological effects in psychoneurotic cases, World War I era. Dr. Clark's spinal apparatus, circa 1878, one of the more bizarre and least practical treatments for scoliosis. Dr. G. H. Byford stands under an optokinetic drum wearing a contact lens with a miniature lamp cemented to it, during an experiment to investigate the reflex movements of the eyes and their association with visual illusions, at the RAF Institute of Aviation Medicine in Farnborough, 1960. Electroretinogram apparatus devised to measure the electric potential of the retina. 1930s. French neurologist Guillaume Benjamin Amin Duchenne conducts an experiment in electrophysiology by triggering a subject's muscles with electrical probes to produce specific facial expressions, 1850s. Lieutenant Ratke presses air into his lungs at a constant height with a mercury column, while a doctor checks his blood pressure, circa 1932. Mental patients participating in dance therapy at the New York State Asylum, 1922. Physiotherapy used to be hands-off, 1920. Post Office Department Inspector D.F. Angier, left, and Dr. L.F. Kebler try out a stretching device that claimed to increase height by 2 to 6 inches, 1931. Röntgen Steed, designed to hold children while they sit for chest X-rays, 1957. Surgeon Louis Albert Sayer observes the change in the curvature of a patient's spine as she self-suspends herself prior to being wrapped in a plaster of Paris bandage as a treatment for a spinal deformity. Circa 1870s. The latest X-ray apparatus being operated by a radiologist wearing the old-type protectors which are no longer necessary with modern apparatus, 1934. The modern Röntgen look-through machine, designed to prevent any injury to the treating physician, Frankfurt, Germany, circa 1929. The new hip massage machine from the United States, circa 1928. Winston Churchill's personal pressure chamber, created to enable him to make high-altitude flights safely, 1947.